Our top focus this evening. Kerala seems to have dodged a bullet yet again. After weeks of restrictions and tiptoeing, the state government has withdrawn most of the Nipah-related restrictions in the containment zones of Northern Kozhikode district and announced that all schools and colleges located within the containment zones will reopen and normal classes will resume from today onwards. However, as a precautionary measure, the public has been advised people to wear masks, use sanitizers, and maintain social distancing. The restrictions on public gatherings and crowding will continue to remain in place till 26th of October. The Nipah virus outbreak was declared in the district on 12th of September after 6 people were infected with this virus, out of which 2 people had lost their lives. Now, to talk further on this development, I'm being joined in by my guest this evening, Dr. Anoop Kumar, Director Critical Care, Aster North Kerala Cluster. Dr. Kumar, I appreciate you taking the time out and joining us here on Mirror Now. In fact, Doctor, you are someone who has been instrumental in identifying the Nipah virus, not just this time, but in 2018 as well, when it entered India for the first time and we saw that outbreak in Kerala. Help us understand, how did you identify the virus?
In 2018, we had a cluster of patients coming from a same family with a history of another family member dying almost 2 weeks back with features of encephalitis. And these group of patients were also having encephalitis features. So along with the encephalitis features, they were having some unusual clinical features. So these made us to suspect the possibility of Nipah, like a cluster, then an index patient before, then unusual symptoms in encephalitis. So that is how we diagnosed in 2018. So here now in 2023 also the same thing repeated. There was a death in the family almost 2 weeks back, that is 30th of last month. Then on the 10th we are getting 4 members from the same family with features of respiratory symptoms this time. But they were also having some unusual symptoms like the slurring of speech and diplopia in the initial patient, and again seizure in a patient with respiratory symptoms later. And these patients were from near to the previous epicenter for Nipah. So putting it all together, we had a suspicion about Nipah and we sent the samples.
Dr. Kumar, speaking about the current situation in Kerala, restrictions, of course, have been eased. But in your opinion, is it safe to say that the Nipah threat is over?
Yeah, Nipah threat is almost over because usually the spread will happen maximum from the initial patient. So the initial patient died on 30th of last month, and his all contacts have been traced, and they were in quarantine, and their quarantine period is almost over. That is 21 days quarantine period, and only 2 contacts develop symptoms. After that, the second group of patients, the transmission chances are very unlikely, and again 14 days are over from that period as well. So it is very unlikely that we will get new cases, and it is very safe in Kerala right now.
Doctor, as you speak about that, these outbreaks we have witnessed have predominantly been in northern Kozhikode of Kerala. Could you help us understand why is that?
No, we cannot find any particular reasons why it is recurring in Calicut. All the parts of Kerala, we are having the fruit bats, which is supposed to be the reservoir for this Nipah virus. And the same bats are present all over India, except some parts of Kashmir. So it is not because we have any particular reasons for the Nipah to recur. But definitely we'll have to study in detail about that. And another point is no other places in India are screening for Nipah viruses when they are coming across such unusual cases or clustering of cases. So we need vigilant surveillance for encephalitis, especially when they are having clustering or unusual symptoms throughout India.
Dr. Kumar, taking a cue from what you said, we clearly have a lot to learn from Kerala's fight against Nipah. In fact, this crisis management currently is also reflective of Kerala's robust public health system.
Yeah, obviously, the public health system is very efficient here in Kerala. That is why, as a clinician, when we had a doubt, we have immediately communicated to the integrated disease surveillance program team and the state health team. So that moment itself, they have started the surveillance in that area. They started screening all the contacts. The contact lists are prepared. Then again, the route map for that area was prepared, and the containment, quarantine, all such the preventive measures were in place within few hours. So the system is so vigilant and efficient.
Dr. Kumar, although restrictions have been eased, what precautions should the public take as far as the Nipah virus is concerned, in your opinion?
As far as this outbreak is concerned, I don't think the public will have to take any more precautions right now. But obviously, as we think the reservoirs are the fruit bats, when you are coming in contact with bats or the half-eaten fruits, etc., you have to take proper hand hygiene, and you should avoid eating such fruits.
Also, doctor, we have discussed about Nipah virus, but we're also witnessing the rise in dengue cases. What are the best measures one needs to take? And could you also bust certain myths that are surrounding dengue for our viewers?
The dengue fever is basically mosquito-borne infection. So the main areas should be the mosquito control itself. So the public health system should act in such a way that they should have proper mosquito control measures, and the public also should be taught that how they have to maintain their surroundings very clean. They should avoid the containers which can hold water, etc. So that should be taught properly, and the clinicians also should be able to pick up the cases easily with appropriate tests, and a misuse of antibiotic, other painkillers, etc., should be also be carried out in such cases.
All right, Dr. Anoop Kumar, I appreciate you joining us on the broadcast with not only your understanding of the current situation, but also giving our viewers the precautionary measures that they need to take. We leave the conversation at that, but we continue to